I wonder if our audience would be interested in knowing what happens when a patient is so sick from coronavirus that they end up in hospital.
What happens?
So what happens is that they become breathless. They can't breathe. Every breath that they take is increasingly difficult. And so, when you're breathless, when you can't breathe, everything gets more difficult. As the disease progresses or as the illness progresses, the patient needs more and more oxygen to help their lungs to work properly. And then there comes a point where the care can't be delivered in a ward. So if you're in a hospital, you've been through an emergency department, you've been admitted to a ward somewhere, then you're having very close observation, you're being visited very regularly by the nurses who are caring for you. And then as you get sicker and sicker, your oxygen levels are dropping and dropping, and you need more and more support. There comes a point where that support cannot be delivered at a ward level, and a rapidly deteriorating patient with COVID-19 is a critical emergency. Patients that crash or require intensive care support deteriorate very, very quickly and have to be transferred to an intensive care unit where really all the effort of breathing is taken by a machine. You have a tube put into your airways and a machine breathes for you. And then as this COVID-19 infection progresses, all sorts of parts of the body start to shut down. So people's hearts don't work properly. Their blood pressure doesn't stay up. Their kidneys don't work properly. And so medication and machines are used to support those processes. Once you're in intensive care and you have a tube breathing for you, a machine breathing for you, machines keeping your blood pressure up, doing the work of your kidneys, you're not conscious. You're asleep, you're deeply sedated. Your family can't talk to you. In COVID-19, your family often can't be with you. So these are the sorts of things that are happening to our patients and to the families of our patients who are getting critically unwell. All of this is requiring enormous nursing interventions, huge amounts of nursing support and medical support. But can you imagine how terrifying it must have been for those patients, people who were getting sick on those ships? They weren't at home, some of them were with some families. They were getting sick and then they got off the boats, at least they were in Australia, and then they came to hospital because they were starting to get sick. So I think, the implications are very real when people get very sick from COVID infection.
It can be a very lonely death.
That's an absolutely devastating part of this illness. I think Stephen might be able to speak to this as well. The construct of progressive illness very much alone, separated from most of your family and friends. We've got restrictions on the number of visitors that can come into hospitals. That's to keep visitors safe. It's to keep the traffic of new people coming and going from hospitals as low as possible to minimise the risk of transmission. But that means people who are in hospital have very, very small numbers of visitors and very small numbers of their family can come. So yes, a very lonely way to be very sick. This is another thing that I think, another aspect to this pandemic that's really going to have enormous implications for our patients and for us as carers.
Stephen Parnas, I know you've thought a lot about the fact that it might not be a family member, it might be you that is there possibly holding a hand, if you can, when someone dies.
Well, I'd say two things, Hamish. One, despite the most intensive support we can offer in intensive care, propping up hearts, lungs, kidneys, all of those things, many COVID patients still pass away. The other thing that I would say is that, yes, one of the most fundamental aspects of being a health worker is to journey with the patient, to be with them, to offer that human contact, to try and ease fears, even if it's a matter of touch. These are the sorts of things that we should always and will give people, whether they are mildly unwell or whether they are nearing the end of their